cardiopulmonary resuscitation, or CPR, for adults. Remember to start emergency scene management using your Lifesaver 101 rules of 1, 2, 3, and ABC. Start with safety, putting on your gloves. Check for response by tapping and shouting. If your casualty is not responsive, sending somebody to call 911 right away, making sure they know what you want and that they come back to you. Once you've done that, focus on the casualty, open their airway, using a head tilt chin lift, check for breathing, bare their chest, and start CPR. Looking for the xiphoid process, the intramemoral line, and the sternum. Interlace your hands and place them in the center of the chest. When we do CPR, push hard, push fast, 30 compressions and 2 breaths at a rate of 100 to 120 beats per minute. Remember, once you start CPR, don't stop. Get good recoil, make sure your breaths are 1 second long, and remember, if you don't want to give breaths or if you don't have a mask, simply continue compressions without breaks. This is called compressions only CPR. To do CPR, make sure your shoulders are over your wrists, elbows are locked in place, and you're bending at the hips. 30 compressions, pushing all the way down, making sure you're getting good recoil. Once you're done your compressions, using a personal protective equipment like a pocket mask, adjust it in place, head tilt chin lift, and give 2 breaths, just enough to make that casualty's chest rise, and then right back on the chest for 30 compressions. You may also be using a keychain mask. Put it on the casualty's face, block the nose, head tilt chin lift, and again 2 breaths in. Continue alternating between compressions and breaths. Common CPR pitfalls: not in good position, bending your elbows, pushing too slow, not deep enough. Remember, with CPR, it's important to push hard, push fast, do 30 compressions and 2 breaths, and keep going at a rate of 100 to 120 beats a minute. Remember, once you start CPR, don't stop. Important to consider recoil, making sure the chest comes all the way up before each compression. Breaths need to be 1 second long, just enough to make the chest rise. And remember, if you don't want to give breaths or if you don't have a mask, simply continue compressions without breaks.